When we talk about longevity, almost everyone thinks first about the heart, the brain, or metabolic markers. Few imagine that one of the clearest signs about the future of your health is in your legs. The strength, endurance, and even the small sensations you feel, or stop feeling, in the lower part of your body reveal the real state of your metabolism, your circulation, and even vital organs that you don't usually associate with your lower limbs. That's why so many researchers today consider the legs one of the most powerful indicators of how long you're likely to live, and with what quality of life. It doesn't matter if you're 30, 50, or 70 years old, what is happening in your legs right now describes, with frightening precision, what is silently happening inside your body. Many people only notice advanced signs when they've already lost muscle mass, when circulation is compromised, or when the sensitivity in their feet begins to fail. And most of the time, these symptoms don't appear suddenly. They come after years of metabolic overload, excess sugar, sedentary behavior, and small inflammations that were never addressed. To understand this, imagine the nerve that leaves your spine and travels all the way to the soles of your feet. It needs a constant flow of oxygen, micronutrients, and clean blood to function. When there is excess circulating sugar, even before a formal diagnosis of diabetes, that nerve begins to suffer. First, tingling and mild loss of sensitivity appear. Then, burning, pain, prickling sensations, or something electric inside the feet. These signs are not random, they are warnings that sugar is damaging vessels, irritating nerves, and reducing oxygen flow to the tissues farthest from the heart. And it's precisely because they are so far away that the feet are usually the first to reveal the problem. Another critical indicator is edema, swelling in the ankles and on the top of the foot. Many people treat this as an aesthetic issue or something normal with aging. But persistent swelling, the kind that leaves a mark when you press it with your finger, reveals a serious imbalance. The blood is not returning properly to the heart. This can occur due to kidney, liver, or heart dysfunction, or simply because the leg muscles are unable to pump blood back upward. When venous return fails, the heart has to work twice as hard. Over time, this cycle leads to cardiovascular fatigue, reduced tissue oxygenation, and a higher risk of serious events. There is also a problem that millions of people silently face: nighttime restlessness in the legs. That urge to move your legs non-stop, that agitation that keeps you from sleeping, that feeling that the muscles are on even when you're exhausted. This condition, which seems like just an inconvenience, is deeply connected to excess refined carbohydrates, alcohol, and the depletion of nutrients essential for the electrical conduction of muscles. B1 deficiency, common in sugar-rich diets, combines with lack of magnesium and promotes the buildup of lactic acid in muscle fibers. This combination sabotages rest, prevents restorative sleep cycles, and increases inflammation markers, something directly related to accelerated aging. In addition, there is a frequently ignored risk: the formation of deep blood clots in the legs. These clots can detach and travel to the lungs, blocking airflow, an event that can be fatal within minutes. The most frightening part is that the triggers for this process are common: long periods sitting, intense stress, and repeated blood sugar fluctuations. The body interprets this environment as an invitation to coagulate, and the first place to show the problem is usually the deep veins of the legs. And what about the arteries? When the internal lining, the endothelium, begins to suffer microlesions caused by high glucose, repeated inflammation, and environmental toxins, the body tries to repair the damage by applying natural bandages made of fat, calcium, and proteins. Over time, these bandages become rigid plaques that narrow the vessels and limit blood flow to the legs. This produces pain while walking, a sensation of heaviness, cramps, and progressive loss of strength, signs that the cardiovascular system has been exhausted for much longer than you realize. Another often overlooked but extremely common marker is the buildup of blood in the superficial veins when the body spends hours without efficient movement. The veins need muscle contraction to pump blood back to the heart. When you spend much of the day sitting, in front of the computer, driving, working, the legs simply cannot perform this pumping movement. The result is stagnation, brownish discoloration of the skin, dryness, hair loss, and increased pressure in the venous system. All of this overloads the heart and slowly reduces its ability to perform basic functions without fatigue. But none of these markers impact longevity as much as the loss of muscle mass. Sarcopenia, the natural process of muscle loss with aging, is one of the largest silent threats to health after age 50. Muscle is a metabolically active organ, essential for buffering blood sugar spikes, protecting bones, stabilizing joints, and maintaining functional independence. When you start losing muscle mass, you lose much more than strength. You lose one of the main defense systems against accelerated aging. And the most curious part? Most of these problems don't start in the muscles or the legs. They start with diet. The excess of refined carbohydrates, simple sugars, and glucose spikes wears down the pancreas, destroys the endothelium, causes insulin resistance, and inflames the entire system. That's why people with prediabetes already show deep symptoms in their legs long before a formal diagnosis. No one explains this because the healthcare system is trained to treat consequences, not causes. As a result, millions receive instructions to monitor glucose or use supportive medications, but almost no one receives the central instruction: reducing carbohydrates can reverse an impressive amount of damage. When you correct excess sugar, you don't just improve lab markers. You reduce stress on nerves, relieve arteries from constant inflammation, support venous return, decrease edema, improve sleep, and slowly recover muscle function. And all these improvements appear first, and clearly, in the legs. If there is one common point among almost all the problems that manifest in the legs: loss of strength, swelling, feeling of heaviness, numbness, burning, difficulty walking, it is the failure of glucose metabolism. Excess sugar disrupts the function of the arteries, irritates the nerves, alters blood viscosity, and generates daily microinflammatory processes. And all of this accumulates first in the most vulnerable structures and the ones farthest from the heart: the feet and the legs. What few people know is that there is a way to interrupt this cycle. The foundation is simple: drastically reduce refined carbohydrates and adopt eating windows that allow the body to rest metabolically. For many, this means 2 meals a day. For some, a single meal is already enough to reorganize insulin sensitivity and relieve excess circulating glucose. These strategies are not abstract theories. Today, there are already solid studies showing that insulin resistance can be reversed in a few weeks when the body stops being bombarded by glucose spikes. The impact of this on the legs is direct: improved tissue oxygenation, reduced numbness, decreased pain while walking, progressive restoration of plantar sensitivity, and a gradual return of muscle strength. It is a cascading effect. By treating the sugar, the body begins to recover functions that seemed lost. But diet is only one of the pillars. There is another element often forgotten: the role of the calf muscles in venous return. Inside your body, this musculature works like a true auxiliary pump for the heart, pushing blood back upward. And there is a specific muscle, the soleus, that has an extraordinary ability to work for long periods without fatigue. It is responsible for a large portion of the ascending venous flow. When this muscle weakens, blood simply accumulates in the legs. That is why sedentary people present cold feet, swelling, and a sensation of heaviness at the end of the day. Training the soleus can transform leg health, and equipment is not required. Slow and repeated ankle contractions, performed while seated, are capable of activating circulation in a surprising way. Many people notice improvement in edema, increased energy in the legs, and even glucose stabilization after a few days of practice. It is a simple but extremely effective strategy for those who work seated, drive for long hours, or spend most of the day immobile. Another essential point is preserving muscle mass. There has never been so much scientific consensus on the impact of sarcopenia on mortality. When you lose muscle, you lose the ability to store glucose safely, you lose joint protection, and you reduce the metabolic reserve needed to age with autonomy. Exercises that stimulate the legs and hips, such as squats, leg raises, movements of sitting down and getting up from the floor, are fundamental to keeping the body young. In fact, there is a simple test, known as the sit-and-rise test, that indicates, with frightening precision, a person's level of functionality. For people who cannot even bend down without support, the first step is to reignite basic mobility. Small partial squats, sitting down and standing up from higher surfaces, and working one leg at a time are excellent entry points. For those with greater mobility, deeper movements, such as the Asian squat, help restore range of motion, stability, and strength in the hips. All of this reduces the risk of falls, relieves lower back pain, and improves the ability to walk long distances without discomfort. Mobility exercises also deserve attention. Rotating the hip, changing resting positions, working the transition from sitting to kneeling and then to standing helps train neuromuscular agility. These movements are not just exercises, they are simulations of daily actions that guarantee independence. Many people only realize they have lost these abilities when they begin to struggle to get up from the floor without support, and this is one of the strongest indicators of loss of functionality. But the legs do not depend only on muscles and circulation. They also depend on mineral balance. The lack of potassium, for example, not only promotes swelling but also harms muscle contraction and disrupts blood pressure regulation. The body needs much larger amounts of potassium than most people consume. When levels are low, fluid accumulates in the tissues, sodium becomes dysregulated, and retention worsens. The opposite is also true. When you provide enough potassium, whether through diet or guided supplementation, the body eliminates excess fluid and improves venous return. And there is one compound particularly crucial for vascular health: nitric oxide. It is responsible for relaxing the arteries and allowing blood to flow more easily. When levels are high, circulation improves. When they are low, the arteries become rigid, blood pressure rises, and the risk of clots increases. There are natural ways to boost nitric oxide: sunlight exposure, nasal breathing, nitrate-rich foods like arugula and beets, magnesium, and cacao. However, modern habits such as sedentarism, alcohol, refined sugar, and constant use of mouthwash impair its production. Restoring nitric oxide means restoring vascular flexibility, and this completely changes leg health. Another vital point is constant movement. It is not just about training once a day, but moving throughout the entire day. The human body was not designed to sit for 8 hours straight. Small movements, 1 to 2 minutes at a time, distributed throughout work periods, can improve circulation and reduce metabolic markers more than a single long exercise session. Climbing stairs, walking in short intervals, performing knee extensions, or simple calf contractions already create a powerful cumulative impact. And while movement rebuilds the circulatory system, sleep repairs the neurological system. Chronic sleep deprivation, whether due to insomnia, restless legs, or irregular routines, increases cortisol, harms glucose metabolism, and accelerates muscle deterioration. Many people treat sleep as optional, but when the subject is longevity, it is as important as diet and exercise. Restoring sleep is restoring the entire body. For those who already have significant symptoms in the legs: numbness, pain while walking, persistent cold feet, edema that does not go away, there are additional strategies that accelerate recovery. Nutrients like benfotiamine and alpha-lipoic acid help nerve regeneration, especially in cases associated with elevated glucose. The combination of magnesium with B1 helps reduce nighttime restlessness and stabilize muscle contractions. In the end, everything comes down to 3 pillars: efficient circulation, muscle strength, and balanced metabolism. When these 3 elements work well, the legs gain endurance, sensitivity returns, swelling disappears, and the muscles respond again. More than that, the entire body functions better. The legs are not just structures of movement. They are a mirror. They reveal what lab tests often have not yet detected. They show how the heart is doing, how glucose is behaving, how cell aging is progressing. And perhaps most importantly, they show, long before any diagnosis, whether you are moving toward a long and functional life or toward a silent process of deterioration. The good news is that almost all of this can be reversed. Strength can return. Sensitivity can return. Stability can return. The body responds. The body wants to recover. The only thing it needs is the right environment. And that environment begins with your habits, the ones you choose every day. If you want to keep your legs strong, your body active, and your mind healthy, subscribe to the channel. Share this content and help more people understand the signals the body sends every day.